Yeah, lay still. Dr. Deukmedjian, 9/30/2021. Last case of the day, left-sided L4-5 Deuk laser disc repair. Okay, I'm going to give you some medicine. Tell him he's going to have a little stick and burn. Okay, and it's L4-5. We all agree? Yeah. It's tough. So we'll do a little numbing medicine first. Try to numb everything up good for him. Watch out for that needle. We injected 5 cc's. Let's see where we are. Shot. All right, that's really overexposed. I think we should go a little north, about 1 inch north, maybe 1 inch north, unless you're going to wag. So the first thing we need to do is get the x-ray set up relative to the patient's spine. And that's what we're doing right now. We want to make sure that the spine and the x-ray are perpendicular, local. And it's not as simple as you might think it is. There's actually a lot of things going on. The spine is three-dimensional, and the connections between the bones and the spine are often not exactly lined up. They rotate, they twist, so you get scoliosis. How's the blood pressure? All right, that's fine. All right, so you can see L4-5 disc. We can see the iliac crest going through about the middle of the L4 vertebral body. It's a little blurry. We're doing pulse, right? All right, I think we're fine. Are you comfortable? Okay, if you have pain, say ouch. Okay? All right. So, shot. Let me give him some more numbing medicine into his muscle. That will make him feel better. This is just some local analgesic or analgesic. Lidocaine, what, 1/4%? Marcaine, 0.5%? In saline. So I'm aiming for that disc at L4-5. That's our target. Shot. And the reason is he has a herniation there. Shot. That's the facet joint. The targeting looks good on the lateral view. I need to go around the facet joint. It's a little higher than I want it to be. Shot. That's better. Shot. It's a little bit of arthritis there in the facet joint. You can see it. I'm right in the middle of the facet joint at this point. I'm trying to go around it. It's okay. Shot. Yeah, almost done. Shot. So we're on our way there. Let's get an AP. You're doing good. Everything's okay. We're almost finished, all right? What did he say? Oh, perfect. Oh, yeah, I'm good. So interesting. We can see on the MRI that there's a disc. Can you, I really want you to watch that. It's so close to her. Can you scroll on the MRI? Just, yeah, scroll with the mouse button. You need to left click on it and then roll the mouse button. There you go. Yep, keep going. Other way. Keep going. Go, 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 go. All right, so keep going. That 5-1 disc, you could see it. It's not a real disc. It's almost like a fake disc, pseudo disc we call it. It doesn't look like it. Come back again. Keep going back and forth till I tell you to stop. Yeah, and back again. So that disc is collapsed, and it's not a real height disc. It's sort of a small disc, and that's what we're seeing down at 5-1. And then 4-5 is the next disc up, and that's the one with the herniation. So I feel like we're in the right spot. You agree, Luis? Monica?
Great.
All right, so looking good. We'll just finish accessing that herniation. We're going through the foramen now. Shot. Do you have much back pain?
It's in the leg, he said, mostly in the leg.
Mostly in the leg. All right.
Here's that shot.
Okay, that's where your back pain is, right? Okay, very good. How bad was that on a scale of 1 to 10? 9? Okay, we found the disc. We're going to fix it for you. When you wake up, it's finished, okay? Now, can you count from 1 to 100 in Korean? Hana, set. Keep going. Nice and loud so I can hear you. You're going to feel some burning in your arm. That's the anesthesia medicine to put you to sleep. It's okay, all right? All right. So, for all my Korean fans out there, we just tested the L4-5 disc with the tear and the herniation. That's L4-5. And it was a 9/10 pain, the typical pain that he gets every day. Nice job, everyone. Any questions, Diego? Now,
No questions.
we're going to remove the needle, leave the guide wire. You can actually see the annular tear and the herniation. And it looks like a bump coming out of the back of the disc. Blood pressure is good. Any way we can get it down a little bit lower? I want to try to get it around 100. So I'm just going to wait a minute until we get a little bit lower. And the reason is I'm not worried about anything serious like an epidural hematoma. I'm not worried about intramuscular hematoma. But when you start getting your blood pressure a little bit up around the 110, 120, you start to get bleeding from small little arterioles, perhaps, and capillaries bleed a little more. Everything just bleeds more. And so it won't cause anything serious, but it will bleed into the muscle. We're good? So that was the propofol effect? Nice. All right, so basically we've got his blood pressure down lower, and I'm very happy. I want to move forward and make the incision. It's 7 millimeters. We're going to bring the dilator down, and it's going to separate the muscle. We're going to go right into the herniation. So we're really not going to do any damage to him except for the incision, which is 7 millimeter skin incision. And thank you, Luis. Nice job. And we're going to move down to the herniation, passing through the neural foramen, just underneath the exiting nerve root, which is the L4 nerve root, and just lateral to the L5 nerve root on the left side. Very nice. What? Huh? The one I just did? They want to leave already? I was just seeing him. He was still sleepy. Oh, so he wants to leave. Real good. I want to know how he's doing, like his leg and everything. All right, so our last surgery already wants to go home. He doesn't want to wait for me to get done here and come see him. But that was the far lateral herniation at L3-4. So this gentleman has kind of a herniation at L4-5, and that's why we're doing his surgery at L4-5. not to confuse it with the last patient who was L4-5. This gentleman came to us from Tampa, St. Petersburg, and he's had horrible left leg pain. I saw him yesterday for the first time, and he wanted to move forward and get his surgery done right away. I told him I would do it when I get back from Italy, and he said, please, I have too much pain. So I decided we'll just do it now and help him out and get out of pain. So what I'm pushing on is the herniation. I'm pushing it back into the disc through the tear. And now we've got our dilator in. I'm going to bring the actual, this tube is what I do the whole surgery through. How's he doing?
Doing great, no leg pain.
No leg pain. He's happy. He can go. Thank you. Nice job, Rita. It's always nice when surgery works and fixes people. Okay. I'm glad we have a bunch of 1 levels, because if these were 2 or 3 levels, it'd be really hard. Hey, Luis, do you have more of these?
Yes.
I would get some more of these from Wolf. You know what I mean? Because the end is starting to flare out a little bit. And it's still okay, but I just want to make sure we have enough. Always. Take it. It's done. All right. So we're going to do the whole surgery through this little tube. Did you get a shot?
I did do another.
Yeah. Okay. Thank you. And you can start closing up if you want. Because we're not going to, I don't think we need you for the rest, because we only have 1 level. So if you want to just be on alert, but go start getting ready to go, that's fine. So we are connecting the fluid adapter, and then we're going to bring the scope in. We're going to go in there and fix this man's disc and get him out of here. Back to his, I don't know if he's going home. I think he probably is, right? He has a driver?
Yes,
Okay. So,
Lights on, please. Scope on, please.
scope on.
Stand by. Monica, stand by light, please. Yeah, thank you.
Uh-huh.
Thank you very much, Monica. Thank you.
I forgot that Monica runs the, what's it called? Scope. But, Rita, do you know how to run it?
No, he's gonna wipe the.
yes, the camera, yes,
You know how to run the camera? I mean, turn on and off the light?
yes.
All right. Well, look how inflamed it is. A lot of inflammatory tissue. Very pink. So, Diego, any questions from the audience? If there's no questions, why don't you run the video animation
Okay.
on what we're doing, how the Deuk laser disc repair works.
All right, it's running. I'll leave you on mute.
It's the lumbar, right?
Yes, yes.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, Submit your MRI for a free review at www.mri.deukspine.com.
Okay, thanks for joining us again, and we are here working on this gentleman's herniated disc, fixing it with the laser. That's the blue fiber, and still have a few chunks of herniation here that need to come out. So I use a combination of the laser to free up the herniated fragments. And look at that, that's a big one. If I can get it out, I think it's gonna break though into pieces. So I'm gonna have, you gotta pinch it. Okay, if you don't pinch it, I don't know if you got it.
Yes, sir.
So I use the feeling of your pinch to tell me I'm ready to leave
Yes, sir.
and go back in. Take. All right, so over there at 2 o'clock is the end plate. That's what's oozing. End plates are the surface of the bone, above and below the disc. Every disc has an end plate above and an end plate below. The end plates are rarely, they don't cause pain unless it's fractured, which we're not dealing with a fracture, obviously, we're dealing with a herniated disc. But the end plates do get inflamed. So the inflammation from the annular tear, not only does it spread to the disc, but it also spreads to the end plate. And that's why with degenerative disc disease, you get these end plate changes. We call them modic, M-O-D-I-C changes. Modic changes are like irregularity of the end plate, pitting of the end plate. Very similar to the kind of structural changes seen in osteoarthritis when you get cyst, what are called endochondral cyst formation inside the cortical bone. So we get the same phenomena here with these disc herniations, annular tears that are inflamed. They can definitely affect the end plate. I don't like that loop right there because it's blocking my hand. So I'm moving my way back, further back, and you can see some of this disc material is pretty collagenized. So is your dad waiting for you?
Yes, sir. You can go. You wanna release it or?
Oh, no, I mean, I don't know. Where's Monica still here, or is she? Oh, do you want to, are you sticking around?
Yeah.
You want to run the laser? All right, Flynn, you can get out of here.
Are you sure, Dr. Deuk?
I'm sure. Yeah.
Thank you very much. Thank you.
Don't worry, someday you'll be the one staying late, Flynn. You're welcome. Have a good night. We'll be done in probably 8 minutes, 10 minutes max. As usual, these herniations are very calcified and collagenized, full of collagen, which is scar tissue. And people just got to stop waiting so long to get them fixed. The longer you wait, the more damage is done. The thing about inflammation is it's like chemical warfare. I was talking about it earlier. And it damages the body, the human body, wherever it is. And the sooner you get rid of the inflammation, the sooner you stop the damage from occurring. So it's just not really emphasized enough in medicine just how destructive inflammation can be. And people are starting to understand how inflammation is damaging to the body more and more. Stand by.
Watch your face.
You gotta have this on the other side of the laser so I don't pull the laser out of your hand. People are talking about anti-inflammatory diets and reducing inflammation in their body. They're really starting to get it, which is good. And I totally agree. Inflammation is really, it's at the heart of so many conditions that are so damaging to people, like Crohn's disease, inflammatory bowel syndrome. Just these inflammatory conditions just destroy the tissues of your body. The soft tissues, especially. What sets it off? Usually trauma. Diego, why don't you run the video? Which animation did you run?
I ran the back DLDR.
The DLDR?
Yes.
Did you run the video on the cause of chronic back pain?
I would do that right now,
Yeah,
and I'll mute you.
that's a good idea.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
And so it should be somebody you are comfortable working with.
You're back, Deuk.
All right. Well, we're not doing it tomorrow. Welcome back. I hope you enjoyed the video animation we created for you. I'm Dr. Deukmedjian, and we're just finishing up this surgery. We're probably going to be done in just a few minutes. But this patient has come to us with back pain and left leg pain, primarily left leg pain. We saw his MRI. He has a herniated disc on the left side at L4-5, and it's really pinching the L5, primarily the L5 nerve root. As the L5 nerve root passes the L4-5 disc in the lateral recess, and the herniation somewhat in the lateral recess at the beginning of the foramen. So unlike the last patient we did where his herniation was completely foraminal in the middle of the foramen, this patient's herniation is more towards the middle of the disc, but not really in the middle of the disc, but just closer to the middle. Now, there's a really weird term in medicine called medial, and you won't hear it anywhere else. And what medial means is closer to the midline. Lateral means further from the midline. So if you think of the midline of a human body, it's kind of where the spine is, right? If you look at someone's back, or it's where the belly button is, if you're looking at the front. So medial means moving towards the belly button or middle of midline, the line running down the middle of a person in their front or back or in the center of their body. Medial. Lateral means moving away from that line. So when we talk about, as doctors, lateral things, we're talking about problems that are out away from the center of the body. And when we talk about medial things, we're talking about problems that are closer to the center of the body. So herniations of the disc can be medial or lateral. They can be central, paracentral, foraminal, extraforaminal. Those are the 4 zones that are commonly recognized. And the last patient, who's already gone, had a foraminal / extraforaminal herniation, which we took care of. And this patient has more of a paramedian foraminal herniation. 1 minute should be all I need, barring anything funny happening. Just about done.
We have a question.
Yes, I'll take the question.
What's the most times a patient has had the Deuk laser
I'm sorry,
disc repair?
Diego, you've got to raise that voice.
Can you hear me?
I hear you a little better.
All right. What was the most times a patient has had the Deuk laser disc repair?
Okay, I'm sorry. I thought I could hear you, but
Okay.
it was just a little bit too light.
All right. How many times has a patient had the Deuk laser disc repair?
What's the most times a patient has ever had the Deuk laser disc repair?
Yes.
Well, that's a great question. I don't really understand it though, because
I believe like multiple times coming in here and having.
but here's the thing. We have patients who have herniated disc in their neck, their thoracic, and their lower back. And they come in and get their lower back done, then they come get their neck done, and then they come and get their thoracic done, or whatever order. So are you talking each of those times as a time? Or are you talking about the number of times that I had to operate on the same disc over again?
I believe it's just on that person. How many times have you done the procedure on that person?
So we have patients who have come in and had cervical laser, then they've been very happy, then they come back and get a lumbar, lower back, and then they may have another cervical or a lumbar or thoracic. The most times is 2, I think. I can't think of any patient that's ever come in for more than 2 herniations. So I've had some patients come in and get a thoracic and a lumbar disc herniation treated at the same time. So I think that's 1 time, according to what the question's being asked. Hey, I just want to say everyone here today did a great job, and I really appreciate all the hard work
Thank you, sir.
and taking care of our patients. You know, being in the medical field is special. You know, you're not selling furniture or working on a construction project. You're helping people get better. And the fact that you all are willing to stay here and help out and get our patients better speaks volumes to your character as a human being, in my opinion. So
Thank you, sir.
it isn't easy, you know, sticking around and getting the job done, but kudos to you all. I know the patients appreciate it tremendously. This patient in particular, I'm sure, will be very happy. I got 1 minute, and I just hope he doesn't mess his back up. So if you're listening to me, watching your surgery video, do not pick up anything heavy. 25 pounds maximum. Do not bend over at the waist to pick anything up from the ground. I will see you hopefully tomorrow, and just take it easy, okay? That should be the end of it right there. A little fat. This is the back of the disc, right where the herniation was. right in this area, and now it's all gone. You can see the crater where the herniation used to be, and the traversing route is going to be right up there. Right past there in that fat there, just at 12 o'clock. The exiting route should be over here in this fat, and it looks good. I'm just gonna do this little bit right here, and I think we're done.
Stand by. Can you turn on the light, please, Monica? Turn on the light, please. Stop off. Iodine.
We're gonna do some antiseptic. Never had an infection. Never want one. No, lay still. We're almost done. You're doing great. All right, let me show you the incision. Everything's good. You're done. Just lay still. Oh, he's just uncomfortable because he's a little light and he feels that. But we're good. All right. Yeah, no one wants no one really likes having a metal tube stuck in their neuroforamen. That the posterior annulus is very sensitive to pain, highly localized pain. That was discovered by Cloward back in the 60s. He would open people up and do a laminectomy and start poking on the back of the disc, and he reported that if he poked on the lamina, it didn't bother them. If he poked on the annulus fibrosis, the outside, it created tremendous localized pain. Actually, he's the one who discovered that. Never really did anything about it, but he was trying to understand why people have back pain. Lay still. All right, Luis, you want to hold and close him up? All right, so go ahead and type up your questions, and I'll be happy to answer them for you. We've done 5 Deuk lasers. Let's get started. I'm Dr. Deukmedjian. We're here with one of our patients who traveled to here from Texas, correct?
No, Auburn, Alabama.
Sorry, Alabama. All right, so Alabama. And why did you come to Deuk Spine Institute?
Because the last flare-up of L4 that ruptured in 1999 was unbearable, and my wife can be a testament to that. Who took care of me for 10 days, crying on the floor, with an amazing, incredible pain.
Okay. And you've had that pain now in your lower back for 22 years.
Yes.
You've tried physical therapy and exercises, stretching, but none of those things worked.
No, temporarily.
Yeah. And where was your pain coming from? Do you know?
It was around the belt region in the back. Yeah.
So the L4-5 and L5-S1 discs had tears, and they had inflammation and pain. He also had sacroiliac joint inflammation and pain. And Dr. Patel standing here, which we don't get to see you very often, but Dr. Patel was a hero. He came in and did the bilateral SI joint injection.
Yep.
So do you still have the pain in your back that you came here with?
No.
It's gone.
It's very, very gone. Yes.
Excellent. Well, it should stay gone. Is there anything you want to say to your audience?
Well, I think more people should come and start looking at this procedure, finding the website, learning about what are the things that needs to be done, such as sending the MRI, and trust on the incredible treatment and experience that I have received from this team. Is relatively impressive, very impressive, and I would recommend it to many of my friends who play golf and has been suffering for a long time.
All right, very good. Well, have a safe trip home.
Thank you.
Well, finally, this is 1 hour after my procedure, and I am walking just fine. I'm gonna turn, very stiff. Three, two, one.
Hi there, I'm Dr. Deukmedjian, and yep, still alive and kicking. It is almost 7:45 Eastern Standard Time, and we are burning the candle at both ends, burning the midnight oil soon. We just finished up with our 5th case for the day. This is a Deuk laser disc repair, endoscopic transforaminal disc repair with an annular debridement and discectomy to remove the herniation. Our patient has been suffering with back pain going down the left leg. They had a herniated disc on the left side at L4-5, and he just finished doing the endoscopic surgery. So everything went well. All of our other patients have already gone home, and I'm sure my staff want to head home soon too. So Diego, what is our question?
All right. After a long day like this, what's your favorite part about being a surgeon?
Thank you. That is an awesome question. What's my favorite part about being a surgeon? Well, I don't know my favorite part about being a surgeon, but my favorite part about doing what I do here, believe it or not, it goes way beyond being a surgeon. I have to run this place and manage 68 employees. My favorite, to be honest with you, is getting people out of pain, knowing that your pain's going to be gone, and knowing what a profound and lasting effect that will have on their life, knowing that their whole life is going to change because of this procedure, because of this hour we spent here, my team and I, to fix their disc. I mean, if you think about how pain robs people of the quality of life, how you can't do anything, you can't be a human being, you can't do your job, you can't clean the dishes, you can't sweep, you can't take the garbage out, you can't play with your kids. Why? Not just because it hurts, but because that saps the energy out of you. Dealing with pain all day. You know, I go to the racetrack with my kid, and I don't really do much. I just sit around, but being in the sun, it just takes your energy out. And by the end of the day, you're just exhausted. And I'm like exhausted, but I haven't done anything. So you feel a little bit guilty about it. But people who live in pain every day, they're emotionally, physically, psychologically fighting this battle that's going on in their body with inflammation and psychological effects of pain, depression, anxiety. And then the worst thing about it is when the people around them don't even appreciate what they're going through and the struggles they have to deal with this pain in their back or neck or leg and arm. And it really affects me to know that people suffer and they shouldn't have to. It's dehumanizing to live with pain every day and not have hope to get rid of it. So yeah, the best part of my day, I could keep going. This is nothing. I mean, the tiredness that I feel is nothing compared to the challenge that these people with pain go through every day. So I could be here all night. I could work through the next day. Honestly, done it many times before. It's in my DNA, I guess. And I could just keep going knowing that I'm helping people get better. So that's the best part of my day. I like working with the people that I'm with, so that's probably the second best part of my day, is knowing that I keep a lot of people employed, and I give them a sense of purpose. You know, my employees have a sense of purpose. They come to work every day, and they get to share in this incredible experience that I have of being able to cure people's pain. And that's priceless. Yeah, they get paid, but you know, there's lots of jobs that pay, but there's very few that pay with the kind of pride and joy and just positive vibes that you get from helping somebody in a way that no one else can help them. So yeah, it's a great job. And somebody was asking me earlier today, well, shouldn't we make another surgeon, because you're gonna, who knows how long you'll be around? And I'm like, I could have quit a long time ago. I've got plenty of money. I don't need it. But I love what I do. And that's what keeps me coming back every day, is just the excitement that I feel knowing that we're going to fix somebody and fix their pain and fix their life. And I really believe that God has blessed me to be able to do this and to have the people around me that also like doing it. And I'm going to do it probably until I have a heart attack, right? Or a stroke someday, you know? This is my mission. This is what God has done for me. This is what God wants from me, and I believe it. I still believe I have to fix the coral disease. For those of you who know me for a long time, you know I've done research on corals and why they're dying, and I know why they're dying. It's a parasite that's killing them, but nobody else understands it or believes it, but I've proven it. Now I've got to figure out how to cure them, and that's harder to do. So I think I have a lot of unfinished work, and it drives me every day to do what I do, and I guess I just love what I do. So that's the best part of my day. Thanks.